Hello and welcome to Health 999. Today, we're talking about something that affects millions of older adults: arthritis. It's more than just aches and pains. Arthritis can truly impact daily life. But the good news? There are ways to manage it and keep living well. Let's explore what arthritis is, how it affects the elderly, and what we can do about it. 1. What is arthritis? Arthritis. It's a word we hear often, especially when talking about aging. But what exactly is arthritis? Arthritis isn't just one single disease. It's actually a way to describe joint pain or joint disease, and it affects people of all ages, though it's especially common among older adults. In fact, arthritis is the leading cause of disability in the United States, and millions of seniors deal with its daily impact. It can affect the joints in your hands, knees, hips, or spine, and it can make simple tasks, like walking or opening a jar, feel like a major challenge. There are more than 100 types of arthritis, but the two most common types among the elderly are osteoarthritis and rheumatoid arthritis. Osteoarthritis, often called wear and tear arthritis, happens when the cartilage, the smooth, rubbery material that cushions your joints, breaks down over time. Without this cushion, bones begin to rub against each other, causing pain, stiffness, and swelling. It's most common in the knees, hips, lower back, and hands. This type of arthritis develops gradually and is closely linked to aging, past injuries, and even genetics. Then there's rheumatoid arthritis, which is an autoimmune disease. That means the body's immune system, which usually protects us from illness, starts attacking the lining of the joints by mistake. This causes painful inflammation, and over time, it can lead to permanent joint damage. Rheumatoid arthritis can affect multiple joints at once, often in a symmetrical pattern, meaning both hands, both knees, or both wrists might hurt at the same time. Arthritis symptoms can vary from person to person. The most common signs include joint pain and stiffness, especially in the morning or after periods of rest, swelling and tenderness around the joints, reduced range of motion, making it harder to move comfortably, a feeling of grinding, cracking, or popping in the joints during movement, and in more severe cases, visible joint deformities. For older adults, arthritis doesn't just affect the body, it can also impact mental and emotional health. Chronic pain can lead to feelings of frustration, sadness, and even depression. It can limit social activities, make it harder to stay active, and reduce overall quality of life. But here's the good news: while arthritis is common, it's manageable. With the right treatment plan, including exercise, medication, physical therapy, and lifestyle adjustments, many people with arthritis continue to live full, active lives. Understanding what arthritis is, how it works, and how it affects the body is the first step toward managing it effectively. In the next section, we'll talk about why arthritis is so common in the elderly, and what factors contribute to its development with age. 2. Why is it common in older adults? As we grow older, our bodies naturally undergo various changes that can increase the risk of developing arthritis. Understanding why arthritis is so common in older adults requires looking at several factors, including the natural aging process, genetics, lifestyle, and environmental influences. Natural aging and wear and tear. The primary reason arthritis is so common in older adults is simply due to the aging process. As we age, the cartilage in our joints, which serves as a cushion to protect the bones, starts to wear down. This is especially true for individuals with osteoarthritis, the most common type of arthritis. Our joints bear the weight of our bodies and are subject to constant movement. Over the years, this repeated use causes the cartilage to gradually break down. Once the cartilage is worn away, bones may begin to rub against each other, leading to pain, swelling, and stiffness, all hallmark symptoms of arthritis. The older we get, the more this process accelerates, making older adults more prone to joint issues. Declining muscle mass and joint stability. As people age, they often experience a gradual decline in muscle mass and strength, a condition known as sarcopenia. Strong muscles are essential for maintaining joint stability and protecting the joints from excess strain. Without sufficient muscle support, the joints are more vulnerable to damage and wear over time. Weak muscles around the joints can lead to altered joint mechanics, where the joint is subjected to more pressure than it was designed to handle. This can increase the risk of osteoarthritis or exacerbate existing joint problems. Hormonal changes. Hormonal changes that occur with aging also play a significant role in the development of arthritis. For example, women are more likely to develop arthritis after menopause, a time when estrogen levels drop significantly. Estrogen is believed to have protective effects on cartilage and bone health. When estrogen decreases, it may contribute to the deterioration of cartilage, increasing the risk of osteoarthritis. Similarly, the hormonal changes associated with aging can affect the body's inflammatory response, making it easier for the immune system to trigger inflammatory processes that can lead to conditions like rheumatoid arthritis, RA. Weight gain and joint stress. As people age, maintaining a healthy weight becomes more challenging due to slower metabolism and changes in physical activity levels. Excess weight puts additional strain on weight-bearing joints like the knees, hips, and spine. The added pressure can accelerate the wear and tear of cartilage, leading to arthritis. Obesity is also a significant risk factor for developing osteoarthritis. Studies show that for every pound of weight gained, an extra 3 to 4 pounds of pressure are placed on the knees. This increased stress can lead to more rapid cartilage breakdown and an earlier onset of arthritis. Genetic factors. Genetics also play a crucial role in the development of arthritis, particularly rheumatoid arthritis. If someone has a family history of arthritis, their chances of developing the condition are higher. Certain genetic markers have been linked to a greater likelihood of developing inflammatory types of arthritis, such as RA. While genetics can't be changed, knowing your family history can help you take preventive measures and monitor joint health more closely as you age. Previous injuries and joint history. Another factor contributing to arthritis in older adults is a history of joint injuries. Previous fractures, sprains, or dislocations can damage the cartilage in the joint, making it more susceptible to arthritis later in life. Even mild injuries from years ago can lead to changes in joint mechanics, causing increased wear and tear on the affected areas. For example, athletes or people who are very physically active in their younger years may be at a higher risk for arthritis due to repetitive movements that stress certain joints, like the knees, shoulders, and elbows. The effects of these injuries may not be felt until later in life, but they significantly increase the likelihood of developing arthritis as aging naturally accelerates the wear on the joints. Reduced physical activity and flexibility. As people age, they often reduce their physical activity levels due to pain, discomfort, or simply a decrease in energy. However, reduced movement leads to weaker muscles and less flexible joints. This creates a cycle of stiffness and reduced mobility, which can worsen arthritis symptoms. When the joints aren't moved regularly, they become stiffer, and the cartilage becomes less lubricated, making it more prone to injury and degeneration. Chronic inflammation and autoimmune disorders. Some older adults also develop chronic inflammation in their body, which is a significant factor in rheumatoid arthritis, RA, and other autoimmune-related forms of arthritis. In RA, the immune system mistakenly attacks the joints, leading to inflammation and eventually causing joint damage. Although the exact cause of RA is still not fully understood, it's clear that age plays a role in the progression of the disease. The immune system tends to become less regulated with age, leading to increased risks for autoimmune diseases like RA. 3. Symptoms to watch for. When it comes to arthritis, recognizing the symptoms early can make a huge difference in managing the condition and preventing further joint damage. Let's go over the most common signs to watch for, especially in older adults. Joint pain. The most obvious symptom of arthritis is joint pain. This pain can vary in intensity, from a dull ache to sharp discomfort that interferes with daily activities. For many, this pain is felt most when the joint is in use or after prolonged periods of inactivity. For example, after sitting for a while or in the morning after waking up. In the case of osteoarthritis, OA, the pain usually develops slowly and worsens over time. It's typically worse after physical activity or in the evening, and it can improve with rest. On the other hand, rheumatoid arthritis, RA, pain tends to come on more suddenly and can last throughout the day. It may be accompanied by other symptoms like fatigue or fever. Joint stiffness. Stiffness in the joints is another hallmark symptom of arthritis. This is especially noticeable in the morning or after periods of inactivity, a condition known as morning stiffness. It can make simple tasks, like getting out of bed or getting dressed, feel more challenging. For some people, stiffness can last anywhere from 30 minutes to a few hours in the morning. If stiffness persists beyond that, it might indicate more advanced arthritis. As the condition progresses, joint stiffness can also become more noticeable during the day, particularly after long periods of standing or sitting. Swelling in the joints. Swelling is another common sign of arthritis, particularly in rheumatoid arthritis. You may notice that your joints appear larger or feel puffy, tender, and warm to the touch. Swelling occurs when the lining of the joint becomes inflamed, which causes fluid to accumulate. The joints that are most often affected include the knees, fingers, and wrists. If the swelling becomes severe or if it affects the mobility of the joint, it's essential to consult a healthcare provider. Swelling can limit your ability to move, making everyday activities difficult to perform. Redness and heat around the joint. If you experience redness or a feeling of warmth around a joint, it's usually a sign of inflammation. This occurs when the body's immune system is actively attacking the joint tissue, as seen in rheumatoid arthritis or in cases of gout. When the joint becomes inflamed, blood flow increases in that area, causing the skin to turn red and feel hot. If this happens, it's important to seek medical advice, especially if the redness and warmth are accompanied by fever or severe pain. Reduced range of motion. A decrease in the ability to move the joint through its full range of motion is another key symptom of arthritis. This can make activities like reaching, bending, or turning more difficult. For example, you might notice difficulty reaching for something on a high shelf, or it may become painful to squat or bend down to tie your shoes. This is a sign that the joint is becoming more damaged, and the tissues around it are stiffening or thickening. As the condition progresses, this limited movement can make it harder to perform basic tasks independently, which can affect your overall quality of life. Fatigue and general discomfort. Arthritis doesn't just affect the joints. Many older adults with arthritis also experience fatigue. This can be caused by the constant discomfort or pain that comes with the condition, leading to tiredness even after a full night's rest. Rheumatoid arthritis in particular can lead to systemic fatigue, as the body is constantly fighting inflammation. This can cause a general feeling of being run down, and may even lead to irritability or difficulty concentrating. Numbness or tingling sensation. In some cases, arthritis can cause a sensation of numbness or tingling in the joints or extremities. This can occur when there is pressure on the nerves due to inflammation or the formation of bone spurs. This sensation is often described as a pins and needles feeling and is most commonly seen in people with rheumatoid arthritis or cervical osteoarthritis, affecting the neck. If left untreated, this can lead to a loss of sensation or weakness in the affected area. 4. How to manage arthritis naturally. Managing arthritis naturally is not just about reducing symptoms, it's about improving your overall quality of life. While medication can play an important role, many people prefer to take a holistic approach to manage their condition. Fortunately, there are several effective natural remedies and lifestyle changes that can help alleviate the pain, reduce inflammation, and support joint health. Exercise. Keep moving gently. One of the best ways to manage arthritis is through regular, low-impact exercise. While it might seem counterintuitive to move when you're in pain, exercise is essential for maintaining joint function. When muscles surrounding the joints are strong, they help support the joints, reducing strain and pressure. Swimming and water aerobics. Water provides natural resistance and supports the body, making these activities gentle on the joints. Swimming helps improve flexibility and range of motion. Walking. Regular walks can boost blood circulation and improve joint mobility. Start with short walks and gradually increase the duration as your joints become stronger. Tai Chi or yoga. These activities combine gentle movements with deep breathing, which can help improve flexibility, balance, and reduce stress. The slow, controlled movements are excellent for maintaining joint function and reducing stiffness. Pro tip: always consult a healthcare professional before starting any new exercise routine to ensure it's safe for your specific condition. Healthy diet. Food is medicine. The foods you eat can either fuel inflammation or help reduce it. A diet rich in anti-inflammatory foods can make a significant difference in managing arthritis symptoms. Here are some key foods to include in your daily meals. Omega-3 fatty acids. Found in fatty fish like salmon, sardines, and mackerel, omega-3s have strong anti-inflammatory properties. If you're not a fan of fish, flax seeds, chia seeds, and walnuts are also great plant-based sources. Fruits and vegetables. Berries, spinach, kale, broccoli, and other colorful vegetables are packed with antioxidants, which fight inflammation in the body. Aim to fill half of your plate with fruits and vegetables at every meal. Turmeric. This spice contains curcumin, which has powerful anti-inflammatory properties. You can add turmeric to your meals or drink it in the form of turmeric tea or golden milk. Ginger. Like turmeric, ginger also has anti-inflammatory benefits. Fresh ginger can be added to smoothies, teas, or meals, or you can take ginger supplements. Whole grains, brown rice, quinoa, and whole wheat products provide fiber, which helps to reduce inflammation and maintain overall health. On the other hand, try to limit foods that can trigger inflammation, such as processed foods, sugary snacks, and red meats. Also, consider reducing your intake of nightshade vegetables, like tomatoes and potatoes, as some people with arthritis find these aggravate their symptoms. Maintain a healthy weight, less pressure on joints. Excess weight puts more stress on weight-bearing joints like the knees, hips, and lower back. For people with arthritis, losing just a few pounds can relieve pressure and reduce pain. Even a modest weight loss can have a significant impact on joint health and mobility. Caloric deficit. To lose weight, aim to consume fewer calories than your body burns. This can be achieved by reducing portion sizes, avoiding high-calorie snacks, and increasing physical activity. Strength training. Building muscle mass can support joints and reduce the burden on them. Simple exercises like bodyweight squats or lunges can help strengthen muscles around the knees and hips. Natural supplements. Support from nature. Many natural supplements can support joint health, but it's important to consult with a healthcare provider before taking any new supplement, as some can interact with medications. Glucosamine and chondroitin. These supplements are often taken together to support cartilage health and reduce arthritis symptoms. They are naturally occurring substances found in the joints, and supplementing with them may help improve joint function. Boswellia, also known as Indian frankincense, this herb has been shown to have anti-inflammatory properties and may help reduce arthritis pain. Vitamin D and calcium. These are essential for bone health, which is particularly important for people with arthritis. A deficiency in vitamin D can make arthritis symptoms worse, so ensure you're getting enough through sunlight exposure or supplements. Heat and cold therapy. A simple yet effective relief. Both heat and cold treatments can provide relief from arthritis symptoms. Heat therapy helps relax muscles and improve blood circulation, while cold therapy reduces inflammation and numbs pain. Hot compresses. Apply a warm towel or heating pad to stiff joints to help relax muscles and increase blood flow. Cold compresses. Use ice packs or cold gel packs to reduce swelling and numb the pain in affected joints. Be sure to wrap the cold source in a cloth to avoid direct contact with the skin. Tip: alternate between heat and cold therapy for maximum relief, especially during flare-ups. Mind-body connection. Reduce stress. Living with chronic pain can be mentally and emotionally taxing. Managing stress is crucial when dealing with arthritis, as high levels of stress can worsen inflammation and make pain feel more intense. Meditation and deep breathing. Practice mindfulness, deep breathing, or meditation to calm the mind and reduce stress. Massage therapy. Gentle massage can help reduce muscle tension around joints and improve circulation. Aromatherapy. Essential oils like lavender and eucalyptus have soothing effects. Try diffusing essential oils or adding them to a warm bath for added relaxation. Living with arthritis isn't easy, but with the right steps, it's possible to stay active, independent, and in control. If you found this video helpful, give it a like and share it with someone you care about. And don't forget to subscribe to Health 999 for more simple, clear, and caring health tips every week. Stay healthy. Stay informed. Thanks for watching.